Drug overdose deaths in the United States have risen dramatically in the last decade. According to the Centers for Disease Control, more than 47,000 Americans died from a lethal drug overdose in 2014. That's about 129 people each day. About two-thirds of all those deaths involved a class of drugs called opioids. They include prescription painkillers and the illegal drug heroin. The crisis is hitting right across the U.S., even rural communities in states like Vermont and New Hampshire. And it's now an issue in the presidential race. Joining me to discuss all of this from Kansas is Carl Lejuez. He is the founding director of the Center for Addictions, Personality and Emotion Research. With me here in the studio is Roland Martin. He's a radio and television managing editor and talk show host. Also with us from Los Angeles is Sam Quinones. He is a journalist and author who's written about America's opiate epidemic. And also with me here in the studio is correspondent Sean Callebs, who's been covering the story for CCTV. Welcome to all of you to the show. Sean, let me start with you. You've just got back from New Hampshire. You were covering the presidential election there. It's one of the states hardest hit by this epidemic. How bad is it?
It's very bad. There are already 75 deaths this year. Mind you, we're not even through the second month. 400 deaths last year. And you're talking about a pretty small state, about 1.4 million people. How did it get this bad? It's staggering to think of just how bad it is and how it cuts across every socioeconomic line you can think of. Now, New Hampshire is chiefly a white state, about 94% white, but it's a pretty good microcosm of what's going on. Appalachia, the U.S. Southwest, those are two areas that have been hit hard. What happens? Mom may hurt her back, go through some kind of surgery, get prescribed OxyContin. She may take 1 or 2 pills, may have 60 in the bottle, puts it in the cabinet, maybe Junior grabs it, tries it. It takes very little time to get hooked onto something like that. Then once that runs out, what happens then? Well, I spent some time at a recovery center talking with a recovery coach, Dennis Dutra. He's somebody who was addicted to opiates for the better part of a quarter of a century. That's us walking down one of the streets, the clinic where he works, and right outside, people prey on those who are desperate. They sell heroin. We talk to him about how bad the problem is and how easy it is for someone to get hooked on this.
How does it get to this point?
I think it's a number of reasons. A lot of it has to do with the spike in prescription opioids, that the doctors are writing prescriptions for people. They're developing that chemical dependency. They're going out, they're getting their prescription stopped. Then they're going out looking for the opioid pills on the street, and then they're not as easy to find as heroin. They're much more expensive. Heroin is very cheap and easy to come by. And so people are starting to turn into heroin.
So, Sean, what are officials doing about this? I mean, law enforcement officials, health officials, how are they trying to bring this under control?
It's difficult, and that's the big thing, just getting a handle on how significant the problem is. Yeah. You know, you talked about the deaths, 129 a day. That breaks down to the number of people who are dying of HIV and AIDS in the 80s and 90s in the U.S., and that became an epidemic, and it got the entire country focused on that crisis and began to make inroads. What's it going to take to make that leap? 129 people each day. If it was any other kind of accident or death, it would get a great deal of attention. It is getting some significant attention on the campaign trail. Jeb Bush has talked about his daughter, the struggles that she's had with, and Carly Fiorina, stepdaughter who passed away. Hillary Clinton has talked at length about getting treatment instead of incarceration. So it is getting attention, but not nearly enough.
Okay, let me go to Carl. Carl, looking at the numbers, the number of people who have died from heroin overdoses has more than tripled since 2010. How addictive is this drug, and why do so many people get hooked on it so quickly?
Well, it's extremely addictive, both physically and psychologically, and that's some of the most difficult part about it. You have the physical dependence, and that makes it incredibly difficult to stop, but then there's also the psychological aspect, the idea that it becomes such an important part of your life. Some people who are addicted actually talk about it almost as if it's a romantic partner, something that kind of takes over their life, and they just don't really have any idea how to live without it. And because of that, it becomes incredibly difficult to stop. We often think that people should just make a decision and hit rock bottom and then they can stop, but what is really happening is there's so many other factors, and it is truly something that really has a grip on people.
Sam, you've written about America's opiate problem, and now we have a situation where death rates in rural areas are outpacing urban areas. You know, any idea of why so many people are using heroin right now, and has it got to the level now where it's seen as a national crisis?
I mean, I think you just heard why. You have a lot of people who are addicted to these opiate painkillers. These opiate painkillers became part of American medicine in a way they never had been beginning in the 1990s, late 1990s. Doctors bought the idea that you could prescribe these pills for all manner of pain. This was a radical new idea. It was very, very controversial, but eventually accepted by American medicine, that you could prescribe these pills for all manner of pain. I mean, wisdom tooth extraction, never were you given opiates before, but beginning in the 1990s, pharmaceutical companies, together with certain pain specialists, convinced just general medicine, general practitioners and doctors across the United States that you could prescribe these pills because science now knew that these pills were virtually non-addictive when used to treat pain. That was a revolution. We went from prescribing almost very little of this to the point now in 2010, the figures that I have are that we use 99% of the world's hydrocodone and 83% of the world's oxycodone. These are opiates, synthetic opiates that you find in drugs like Vicodin and OxyContin. And it's just become a kind of conventional wisdom in medicine. And this is the problem. This problem starts because of for the first time since World War II, really, we have a drug scourge not started by mafias or drug dealers on the street or street traffickers of any kind, but rather the oversupply. It's caused by supply created by American medicine, doctors all across the country.
Yeah, I want to get to that in a moment, but Roland, let me ask you this. Heroin and crack cocaine addiction has devastated minority communities, inner city communities. But now that heroin is hitting white communities, it's being talked about not as a crime problem, but as a health problem.
But that's the only reason this is an issue. White folks are dropping dead across America. That's the only reason you have Republican candidates who normally are all about law and order, all about dealing with crime. And what was interesting is you had parents and other folks in New Hampshire who literally were telling candidates, please show compassion. You didn't hear them saying the same thing about folks who were addicted to crack. You didn't hear them saying that about crack mothers and grandmothers and grandfathers in dealing with that. No, it was, oh, throw them in jail. We can't have that in our society. That's the only reason all of a sudden this thing has become a major issue. So I think it's very surprising how the language is totally different. The response is totally different. And so you now have candidates who are saying, yeah, that treatment thing, we might want to do that. If you actually go back to the beginning of the war on drugs, President Richard Nixon, who really started this whole process, he said we must have a war on drugs, but he was very strong about the issue of treatment. If you go back and watch some of those old videos, you will literally hear him talk about the importance of treatment. But when they realized the potent power, not of the drug, but the drug of crime and punishment, that's when it all changed. And so we went from the early 70s all the way through the 2000s, lock them up, throw them in jail. Now all of a sudden you have prison budgets exploding. Now all of a sudden you have people saying, we can't afford to keep sending people in prison. It's cheaper to go to have them get treatment. Now the dialogue is changing, but I would have liked to have seen this type of compassion from Republican candidates and Democratic candidates 20 years and 30 years ago when the crack epidemic exploded.
Carl, I want to get back to something that Sam was talking about just a moment ago, and that is, you know, we know that a lot of these drugs can be obtained illegally, but as Sam pointed out, doctors also prescribe these painkillers and other drugs that are addictive. So is it time to start monitoring this a bit more closely to see why there's this explosion of prescriptions on these drugs?
Yeah, absolutely. I mean, I think it's not the time now. The time has been the case for quite a while. And I agree with some of the points that Roland just made, that these are not just issues now. These have been issues through time, and maybe we can learn some things about the specifics of heroin, but when you look at crack cocaine and other drugs, the lessons are there, and we've seen these same problems, we've repeated the same issues, and it's absolutely time that as a society we think about this in a comprehensive manner and not just make it the responsibility of the people who are addicted.
But you also have to confront the fact that the folks who are getting these drugs, this also is a health insurance thing. Now, this is going to blow folks away. Studies show that doctors have been unwilling to prescribe prescription drugs to African Americans out of fear they would get hooked. Now, when you talk about health disparities, that's a good one for black folks, that it worked out for black folks that doctors were not prescribing us opiates, so therefore it wasn't as easy to get addicted to heroin. But when it comes to whites in America, they've been prescribing these drugs. Right. You also have to have stepped up of enforcement from the DEA to target these pill mills, to target these doctors who literally are targeting people. I mean, I knew of a young lady I went to high school with. Her father went to prison because he was overprescribing. This is a serious issue, but I'll give you an example. Michael Jackson, what happened there was addicted when he had the scalp issues with the Pepsi commercial, was taking Demerol, and then all of a sudden he would go into the doctor's office, get a shot of Demerol, which is essentially a professional grade of heroin. And so you have to examine that. You're seeing this now with athletes as well. This also now forces us to go into the whole medicinal marijuana conversation, because you're dealing with people trying to figure out, how do I treat chronic pain? So they can't keep getting drugs. They say, look, I don't have a choice, so I can't use marijuana in my state. I'm going to go to heroin.
Yeah, I want to get to Sam. Sam, you've done a lot of work on this. I want you to take a listen to what Bernie Sanders, the Democrat candidate, had to say. Let's watch.
This may seem like a radical idea, but I think we have got to tell the medical profession and doctors who are prescribing opiates and the pharmaceutical industry that they have got to start getting their act together. We cannot have this huge number of opiates out there throughout this country where young people are taking them, getting hooked, and then going to heroin.
So, Sam, question is, what responsibility do doctors and drug companies bear? And I'm wondering if we just address the question that Roland raised. You know, is there a drug element, at least a race element in this?
Yeah, I mean, there's been a lot just said right now. It's difficult to respond to it all. I would say that what Bernie Sanders was saying was true. The problem is that this is now conventional wisdom across America. This is not pill mill docs. Pill mill docs are a minor part of this problem. You know, you have maybe 1% of the problems created by scandalous, irresponsible doctors. The real problem is that every doctor in America believes this is the way you should treat pain. Mm-hmm. Every wisdom tooth, you get 60 Vicodin. I had my appendix out, every appendix operation, you get 60 Vicodin. You get way too much. And if it were only a few bad apples, it would be very easy to deal with. That would be that we would not be having this conversation. It is that this has become conventional wisdom. It's become conventional wisdom for a lot of bad reasons, due to pain specialists, as I said, and pharmaceutical companies promoting this as the only solution, by insurance companies cutting back on other pain treatments. It's a complicated story. I would say, regarding the race issue in this, I was a crime reporter during the crack years, and what was different now, as your other guest said, is that there was no discussion in the 1980s of what kind of treatment ought to be provided. It was a lock 'em up kind of idea. There is a big difference. There is a big difference between now and then, apart from the race, which is a huge difference. Yeah. This one is almost 95% white people, I would say. Back then, it was very public. There was public violence. There was drive-by shootings. I covered a lot of this in the town I lived in. It was greatly affected by this. So the urge was kind of like very strong to do something now, immediately. There was not a lot of nuance in the conversation. Now, this problem has been percolating, as one of your other guests said, I really think for 20 years. This is only recently in the last 6 months, 9 months, has this become the issue, national issue that it's become, and it's been changing the language of things. But it's been hidden because it's mainly been white people affected.
Right.
Those are middle-class white people who are terrified of the word getting out that their kid died of a heroin overdose,
Yeah.
or is in rehab in Wyoming in some clinic there. And so this is the race issue. It's a very complicated thing. It doesn't give itself to easy prescription.
Yeah, because you didn't need open air drug
race
markets.
is a problem.
You don't have open air drug markets for people who are middle class. They go to the doctor. But you had people who
Right.
were in inner cities who went to the open air drug markets. That's the difference.